So let's maybe discuss comparison between, because now we could understand how it started in Israel. Let's talk maybe about Canada, US, and Europe. So we know these are very different models. So the models in Canada it started generally in around 2001, and they were regularized. They regularized also recreational use in Canada in 2018. So it's a region where both medical and recreational use are coexisting. Canadian patients with a medical authorization can buy medical cannabis from licensed producers in various forms. So they have access to dried flowers, oils, capsules. And Canada has very open system where patients, once they have this cannabis product, have a lot of control over their treatment. They they can grow the medical cannabis flowers by their own for their use. In the US, as we know, it's more complicated because it's federally illegal, but starting from 1906 in California, many states separately started legalize medical use. So we know that in the US, FDA didn't really position themselves regarding medical cannabis use. The majority of the states allow the use of cannabis. They group it in dispensaries, so the patients in the US, they receive the license, then they have recommended product, but by the end they are going to dispensaries. They see a huge offer of various products without any control, because again, FDA is not there. There is no quality control. Very often the product, the labels are not really reflecting what is in the product. There is no quality control. We don't know what about contaminants. And there is a huge competition of the product on the US market, so the patients are lost. So it's really like completely opposite what is going in Europe, because in Europe there's less product, it's more conservative. Again, we are requiring in Europe the clinical studies, more and more data, and it's not on European level, it's on national level. Some countries, again, like Poland and France, we have magister formulation. Poland and Germany, we have magister formulation. In France, we had the pilot project for 4 years. In Denmark, we had another pilot project which is already lasting 7 years. So we know that in Europe we are more strict. We are requesting clinical data, and our patients, they has limited access to medical cannabis product. So what is the perfect regulatory hybrid system to allow widen use of medical cannabis under control quality system? What do you recommend? What is your experience here?
So if you look at the U.S., the big advantage of what happened in the U.S. and in Canada is the explosion of the number of products and the innovation in cannabis, and now with other botanicals and psychedelics, is really because of the open market that created innovation and reduces cost and let's call it democratizes the use of cannabis for everyone at much lower cost. So reduces costs is a big part of the approach that the U.S. And Canadians took by creating competition. The biggest problem that I see is not with CBD products, because that's I think it should be it should really be driven by consumers, and with high quality products like the one that being developed by Braun, being something available to any consumer, ideally with physician supervision. The problem is THC, and I think that's where it should be regulated, and I think there should be a cap. Even if there is recreational, I think in many states they're thinking or doing already, putting a cap on the THC levels on the recreational side and trying to force people to have a prescription management and physician supervision when it comes to higher and higher THC levels. So I think that's where I think there is a clear boundary between the recreational and the medical uses should be on the level of THC. But having competition is good. It creates a lot more products. We see a lot more products in Europe, in the U.S. than in Europe because of that. And so I think the right approach is some kind of a middle ground, a hybrid, where you have both recreational and medical uses, and that will improve, I think, the quality of products and reduce costs to the patients.
Yeah, because here, if we analyze what is going on in parallel, so in the US we have such a markets are such oversaturated by the various products. So we almost cannot, we can speak that those are not patients but consumers. Like for the food supplements, for example, they have all these gummies and all very palatable products offering high THC. And again, there's lack of supervision of the quality, so or underdose of overdose products. Okay, and then in parallel in Europe, we are imposing the more and more exigencies from clinical evidence. The high authorities of the health in most of the countries, they are telling there is no enough data to approve this indication we just mentioned. So we can say that it's like two opposite directions happening in parallel. We know that the best would be to let the health authorities communicate together and create some kind of best option involving all the counterbalancing the fault and the advantages for both approaches. What do you think here?
So again, I think having consumer healthcare products is not bad. I mean, it exists today, even in the pharmaceutical industry, and there's no reason why we wouldn't have consumer products that you could just go into a pharmacy.
So I'm sorry, like OTC product,
like OTC
cannabis without prescription. You think it's possible?
Yeah, I think that's the way it should be, and I think there should be a cap on the THC levels and those kinds of products. I think the boundary should be between the different products should be on the THC level, but I don't see any problem with consumer healthcare products. It's something that exists today, reduces costs and improves the quality and the competition between the companies. The real problem is when you start going to higher and higher THC levels, you can have effects. And I want to correct myself because I said that you could use it always. There are reasons not to use cannabis. A patient with chronic lung disease, you're not going to give them vaping or smoking. It's not something you want to give them. Allergies could be aggravated by CBD, because so you really have to be go slow and start low when the patient has a disease. But a lot of people that use cannabis have no other medication. They're basically going and using cannabis for recreational use. They're using it because they want to improve their sleep or their sex or whatever. So the recreational and the medical products are two different products. I think the real problem is, if we just step back for a second, is that when you start talking about patients with chronic diseases, and it doesn't matter what that the disease is, you see polypharmacy, patients that have so many drugs that they're getting, and there's interaction between these drugs, and no one's done a clinical trial on the interaction between these different drugs, and they go to the doctor, and the doctor has to do something. And so I think if you start using cannabis, you're going to reduce the number of drugs they're getting and improve their quality of life. So I really think that it's really going to be much more advantageous for the elderly. I think we should, and that's actually the fastest growing segment in the U.S. in medical cannabis is for the elderly, where they don't want to do the polypharmacy, first because it's the healthcare system in the U.S. is broken and costs a lot of money. And they're using cannabis, medical cannabis, to replace some of the drugs that they're getting because it helps them and it also reduces costs. And there's no reason that shouldn't be the case in Europe as well.
Do you think that we can say that medical cannabis can be used, maybe not like a main product for the specific indication, but maybe supplementary product to, I don't know, to solve some problems that other medication cannot? Like we have, for example, we are talking again about palliative care patients. Those patients in this group, they are really, how to say, on the way, on the last path, we can say, and we don't have a solution in their cases. So we were mentioning from the beginning that endocannabinoid system is so important, that it's our central panel of the body, and you were talking also about hermesis. So there is the stigma we know about medical cannabis, and the doctors who would like, for example, starting prescribing medical cannabis, how they can found themselves. Imagine that here in Poland we have supervision of the quality of the product, so they don't have these fears like, for example, the doctors in the US could have. But so they are confident in the quality of the product, but how to start? If, for example, we have this very vulnerable group of patients, palliative care of patients, how to start to use medical cannabis? We know, you repeated several times, slow and low, but how to
So I
solve?
said, there's no risk. I mean, as opposed to other drugs, when you give a drug as a physician or a pharmacist, you're always concerned about the risk. So there's very little risk, if at all, with cannabis. So there shouldn't be any concern about risk. The real issue is, can you reduce other drugs by giving cannabis? Because if the patient is coming to you, and this is the last resort, basically they've tried everything else and it didn't help, and now you're giving cannabis, well, can you reduce some of the drugs that they're getting? Because this whole idea of polypharmacy and the interaction is challenging for any drug. And I think cannabis, the big advantage of cannabis is that it addresses so many different problems that we have in daily life, like sleep, anxiety, pain. So if we reduce that, it'll help for all diseases, basically. So if the patient comes to you with some problems, do you really ask them how well they're sleeping? A lot of doctors don't ask them. I think if you start asking, you'll see that many patients have problems with sleeping. They have anxiety. Well, maybe some of the problems that they have is related to their sleep and their anxiety, and if you give them cannabis, you'll help them and reduce the number of drugs they're getting. So I think if the patient is coming to you and they've tried many different things and it's not helping them, I think it's actually I'm going to say even unethical not to try cannabis, because it could help them. There's no risk to give them. The worst thing that can happen is that you may not see the effect immediately and you have to increase the dose, but you're not putting the patient at risk. So why not give cannabis?